State health leaders are ready to spend money on children's mental health. More than half the counties in North Carolina have no child psychiatrists, and the need has only grown since the pandemic. WRAL's Monica Casey has been looking into a new plan released today that takes the first steps to meeting that need. Monica?
Experts agree we are in a nationwide youth mental health crisis. The state of North Carolina is one of the worst in the country for resources for these young people in need. This new plan from DHHS would put funding in schools to fill that gap. Dr. Jaylon Close is a pediatrician and child psychiatrist at Duke. She has seen firsthand the increase in the number of children coming to the emergency room after a suicide attempt.
I think both myself and many of my colleagues struggle with knowing that there are often too few resources to meet the needs of kids.
Dr. Close is one of the authors of the new School Behavioral Health Action Plan. It asks for support for mental health first aid, funding for school health advisory councils, and the expansion of telehealth services.
Having the supports within the school allows them to not have to be pulled out in order to focus on their mental health.
With this plan, do you feel optimistic about the future?
I do. I do think that the strategies in this plan can really move the needle for youth mental health.
Hanalea Hoberman is the NCDHHS Senior Advisor for Children and Families. The plan calls for $100 million to establish more social worker and school nurse positions.
We know that if there is care in school, that those young people are most likely to get access to the care that they need.
This map of North Carolina shows where there are and aren't child and adolescent psychiatrists. More than half the counties in the state are in the red, meaning they have none. This plan also asks for state funding for programs funded by federal money during the pandemic and a statewide electronic health record system. Deborah?
Monica Casey live for us. Thank you, Monica.